So what is this nerve conduction? It is nothing but an electrodiagnostic procedure. So where we are going to see the electrical conduction of your motor and sensory nerve. So basically there are two types of nerve conduction study, where you are going to do it on motor nerve or you are going to do it on a sensory nerve. Okay. So what is the primary objective is, we'll be trying to calculate the nerve conduction velocity. Okay. So what is this nerve conduction velocity is? The speed at which this action potential is going to propagate along a neural pathway is your nerve conduction velocity. So by this study, we are trying to measure the nerve conduction velocity. Fine? Yes. So what are the factors which is going to affect your conduction velocity? One is your fiber diameter. Okay. As the diameter is going to increase, what will happen to the speed of the conduction? It is going to be faster. Okay. And it is also going to, it is your myelination, whether it's an unmyelinated fiber or it's a myelinated fiber, as well as your internodal distance is also going to play a role here. See, if it is going to be an unmyelinated fiber, there is going to be a continuous impulse conduction. Okay. Whereas in your myelinated fiber, it is going to be saltatory type of conduction, where the impulse is going to jump from one node of the annulus to the other node. So this is going to be faster. So okay. So what we are going to do in a NCS study? By NCS, how we are going to measure the velocity? We will simulate a case. Okay. Let us consider a racer. Okay. Okay. He is a racer. Let us take, he is going to start the race at T1 time. Okay. Let us take, assume it as 10 a.m. Then he is going to finish the race at T2. Okay. So at 10:05. So what is the time taken for him to finish the races is going to be 5 minutes. Okay. And if we know this distance, what he have covered, then we will be able to measure the velocity, right? Because velocity will be displacement by time. So if we know the time taken and if we know the distance what he had covered, we'll be able to calculate the velocity. The same principle only we are going to apply in the area also. Okay. So this is the NCS apparatus we are going to use. Okay. So this is the power supply unit and this is the main console unit. It's an NCS machine where we'll be all the amount of stimulus, everything will be analyzed here. So this is the stimulated box to which the this is the stimulator box. To this only will be stimulator. This is an handheld stimulator. Okay. And you have anodal end and cathodal end for it. And the distance between this anode and the cathodal end is going to be 2 centimeter. So this is what we are going to keep along the course of the nerve and we are going to give the current. Okay. And these are the electrodes. There are both invasive and invasive as well as non-invasive electrodes are there. All these are non-invasive electrodes. Okay. So there are different types of non-invasive, like this is called as ring electrodes, where we'll be using for upper limb sensory nerve conduction. This is plate electrode, cup electrodes. This is the electrode paste. And apart from the electrodes, we need the measuring tape, rubbing alcohol and sketch pen for doing this procedure. Okay. And these are to which we'll be connecting our electrodes. So we saw the hardware, right? So that hardware will be connected to this PC. And we have a software for it. That is nothing but NeuroPack. So we'll be getting a real-time action potential on the screen. Okay, so what we are going to do, we are going to stimulate the nerve at one point. And using the electrodes, we are going to pick up the action potential at a distant point. That is what we are trying to do. Okay, fine. So let us start with the sensory nerve conduction first. Okay. So let us take a median nerve. Okay. So what is the cause of median nerve? So it is mainly going to supply your forearm muscles, thenar muscles, and is going to give the sensory supply to your region. Okay, and to the terminal phalanx on the dorsal surface. Okay, fine. So what we are going to do is we are trying to find the nerve conduction study of the median nerve here. This is the example for you. Okay. So what we are going to do, we will be stimulating the median nerve by applying an appropriate current at one point along the course of the median nerve. Okay. And we are going to place the electrode at a different point where we are expecting the impulse to be conducted. Pick up the conduction there. Okay. So first we'll be using the rubbing alcohol and along the course of the median nerve, we'll sterilize the area. Okay. And this is the ring electrode we are going to use for the median nerve. So you know this middle finger will be entirely supplied by your median nerve, right? So what you are going to do, you are going to place the active electrode, that is your recording electrode in the proximal pharyngeal joint. And here you are going to place your reference electrode. The distance between the active electrode and your reference electrode is going to be 5 centimeter. Okay. Now we have to stimulate the nerve at a distant point, right? So usually for median nerve, we'll be keeping at 14 centimeter. That is where we are going to get the adequate response. Okay. So along the course of the nerve, so from the active electrode, measuring 14 centimeter and using the sketch pen, we'll mark the stimulating area. Okay. Fine. So this is going to be 14 centimeter. Now you know the distance between the active electrode and the stimulating electrode. I mean, this is a stimulus point. This is the point where we are going to record the stimulus. So you know the distance is going to be 14 centimeter. Fine. Now between the active electrode and the stimulation, to place the ground electrode. This is in order to prevent your noises. Okay. Fine. So this is going to be a recording electrode, your reference electrode, this is ground electrode, and your point of stimulation. And you also know the distance between the recording electrode and the point of stimulation is going to be 14 centimeter. Okay. Now we will keep the stimulator. Usually the cathodal end will be nearer to the active electrode. And then we'll be start stimulating. Stimulating means we'll slowly increase the ampere of the current. Slowly from 0 ampere, we slowly try to increase. Okay. At adequate response, you will get the action potential. Okay. So what's the concept behind this sensory nerve conduction study? So you know the peripheral receptors are going to be on the peripheral end. And the axonal body will be on the proximal side for sensory nerve conduction. Okay. The direction of impulse transmission will be from your distal towards your proximal site. Okay. So this is physiological type of conduction. We call it as orthotomic. You know, remember or not? Yes. Now, what we are doing actually, so we are placing the active electrode in the distal interphalangeal joint, reference distally, and the point of stimulation what we are giving is in the proximal site here. Okay. So whenever we are going to give one stimulation in your nerve pathway, so it will be transmitted on either side, right? Yes. So what we are going to give, we are going to give the stimulus here and we are trying to record it here. So we are going to do it opposite way. Usually the transmission is from peripheral to proximal side. But what we are doing, we are giving the stimulus here and recording it distally. So we are doing an antidromic type of conduction. Okay. So we are doing the antidromic. Okay. So now we'll start with the procedure. Okay. So what we'll do, we'll connect all the electrodes. We'll start with the stimulator. Okay. Start with 0 ampere. Slowly we'll try to increase the current. At one point we will get the adequate response. So all these real time you will be seeing on the display. Okay. At one point you will be getting the adequate response. So that you will be studying it as sensory action potential. Okay. So this is how the curve will look like in your PC. So initially what you are getting your stimulation artifact. That will tell us about when the stimulation has been started. Okay. And then you have a biphasic response here. So that is going to be your sensory nerve action potential. So now the time taken for the stimulus, from the time of stimulus to the start of this action potential, is going to be your onset latency. Okay? And the duration of the nerve action potential is going to be from the start of the action potential to the time where it has reached to the baseline. So this is going to be your snap duration. And from your peak to the baseline, that is going to be your amplitude. Calculating the nerve conduction velocity, we need this onset latency. Okay? So from the point of stimulus to the point where we have got the action potential. So concentrate on the onset latency. Okay? So as we know before itself, the distance we calculated from the stimulation point to the active electrode, it was 14 centimeter. Okay? And now we know the onset latency also. Okay? The onset latency will be given by the PC itself. Okay? So we'll be knowing the onset latency. Now to calculate the velocity, we need to just divide the distance divided by time, will be conduction velocity. Okay? So in the example, we have got the onset latency as 3 milliseconds. So 14 centimeter divided by 3 milliseconds will give us the conduction velocity. Okay? For each nerve, according to the lab, there will be standardized value. So whatever value you have got, you will be comparing with the standardized value and then you will be interpreting your results. Clear? So this is for your sensory nerve conduction study. So both stimulus as well as response, you are going to pick up from the surface of the nerve itself. Okay? Now we'll go to motor nerve conduction study. So in motor nerve, what you're going to do is, so there's going to be a difference between the sensory and motor. In motor, we are going to place the electrodes over the belly of the muscle. For example, your median nerve is supplied by abductor pollicis brevis, right? So we are going to place the electrodes over the belly of this muscle. Okay, and then we'll try to pick up the action potential. Same thing. First, we'll use the rubbing alcohol. We'll sterilize the area. And here you can see we have placed the active electrode over the belly of your abductor pollicis muscle. And reference electrode 5 centimeter distal to it we have placed. Okay. Next, for motor nerve median nerve, the point of stimulation, 8 centimeter from your active electrode. There it was 14 centimeter. So in order to get the adequate response, here we are going to place 8 centimeter from your muscle belly. Okay, we'll measure that 8 centimeter and then we'll mark it with sketch pen here. Okay. So now this is going to be your recording electrode, reference electrode. We have marked the point of stimulation here, 8 centimeter from your recording electrode. So between the stimulating end and your recording electrode, we have placed the ground electrode. Okay. This is the point of stimulation and we know the distance as 8 centimeter. Okay. So what is the concept behind this? Motor nerve. Okay, all of you get up for 1 minute. Stand up. Fine. So what is the concept behind this motor nerve? So we know the active electrode we have placed over the belly of the muscle. Okay. And reference electrode still more distally we have placed. Okay. This is your recording electrode. This is your reference electrode. And the point of stimulation we are going to give here. Okay. So whenever we are going to stimulate the nerve, transmit on both the sides. So here we are giving the stimulus proximally and recording it distally. This is the same as in your motor. In motor, it will be the impulse transmission will be from your proximal to distal site only. So this is orthodromic configuration. Okay. Fine. So after doing the procedure, you will be getting a compound nerve action potential like this. Okay. So the initial thing, what nothing but a stimulation artifact, this will tell us when the stimulation was given. So the distance between the stimulation artifact where it has started and to your point of your starting with your action potential, that is going to be your onset latency. Okay. And from the baseline, I mean from the start to again where it has reached to the baseline, it's going to be your compound action potential duration. And from your peak to the baseline is going to be your okay. So from this, again, you have to concentrate on your onset latency. Okay. Right. Sit down. So from same thing, right? We know the distance now. We know the onset latency also. But there is one thing you have to remember in your motor nerve conduction. That is your neuromuscular junction. So what happens is, see, when the nerve is going to be transmitted along the nerve, so it has to reach the muscle here. So in between this, you have your neuromuscular junction. So the impulse has to get transmitted through this neuromuscular junction. There is going to be a small latency. Okay, for the vesicles to get transmitted and for the neurotransmitter to flow along the synaptic cleft, there's going to be some time delay, right? So whenever you're calculating the onset latency, this onset latency of the motor nerve will actually contain your neuromuscular junction delay also. Okay, so when you're calculating the nerve conduction velocity, this delay also will be included and we'll get a false value. So we have to ignore this neuromuscular junction delay. Okay, so what we are going to do? So because there is the onset latency is going to include your small delay because of your neuromuscular junction. So this will be giving a false value. So what we are going to do? We are going to ignore this neuromuscular junction. Okay. So we are going to stimulate it from two ends. One, already we have the first point of stimulation will be 8 centimeter from your active electrode. Okay. Okay. We know the distance is going to be centimeter. Now we are going to give further proximally and we are going to go for the second point of stimulation. Let us consider it is 8 centimeter from your, 18 centimeter from your active electrode. Okay. 2 point of stimulation. Okay. So we are going to have 2 point of stimulation. So from this point to this point, we'll have one onset latency. And from proximal side, from the second point of stimulation to this active electrode, we'll be having a second onset latency. Right? So 2 onset latency. For both this pathway, this area is going to be the common pathway. So we know this area. So what we will do, we'll minus T1 from T2. So that we will be calculating the impulse conduction in this part alone. Okay. So that is what we are trying to do. So from from T1 stimulation, we are going to get T1 onset latency. And second point of stimulation, we are going to get T2 as the onset latency. Now when we minus T1 from T2, we will be able to get that. So let us consider that T1 as 3 milliseconds and T2 as 5 milliseconds. And to overcome, we'll be minusing these two. Okay. So the onset latency from the first point of stimulation is going to be 3 milliseconds. Second is going to be 5 milliseconds. And when we minus T1 from T2, we'll be getting this part alone. So that is going to be 2 milliseconds. And the distance is going to be 18 minus 8, which is going to be 10 centimeter. So using this displacement and time, we'll be able to calculate the velocity for that intermediate part. That is only which is going to include your nerve part, not your neuromuscular junction. Okay. So on calculating the impulse, we know the distance as 10 centimeter. Time taken is going to be 2 milliseconds. Now when we divide it, we'll get the conduction. Again, we'll be having a standardized values for each nerve. We'll be comparing with our result, whatever we have got, and then we'll be interpreting our values. Clear? Okay. So these are the standard values what we are following in our lab for motor nerve conduction study and sensory nerve conduction for different nerves. Okay.